Hello, I'm Karl Buche with Great Lakes Seminars, and I wanted to tell you a story today that might help you in your practice. Recently, I treated a 30-year-old male with low back pain. Imaging was a little sketchy to me when I looked at it, but his doctor said it was fine. He saw an orthopedic doctor who said it was fine, a neurologist who said it was fine, and a PM&R doctor who said it all looked fine. And when I looked at the imaging, I saw that one of his vertebrae looked a different color than the rest of them. And my question was, well, what's actually happening with that vertebrae? Is that's exactly where his pain is. And the report from the radiologist said that it's a benign issue, nothing we need to worry about. When I tested him, I couldn't find anything that made it better. And I know a lot of techniques, and nothing made it better. Nothing changed it at all. I couldn't make it better. But even more concerning, I couldn't make it worse. And on top of that, he had lost weight recently and was not planning to. That was another key sign that something might be wrong with this person. And we let it go probably a little too long. I was trying as many things as I could think of to try to change his pain at all. And it's always difficult when you have multiple doctors telling you everything's fine. Just keep going to PT, you'll get better, just keep working on it. So after a couple weeks, I just knew this is not getting better. I showed that MRI report to another one of my friends who's a physician, and he said, if that was my spine, I'd be concerned. Even if it is a benign issue, I'd still want it biopsied to see what's going on. So eventually, I talked to this patient, you're not getting better, I need to send you to a different doctor just to see if another person's opinion would be different than the ones you've already seen. So we went to a different doctor. That one said, your pain's not getting better. Your PT said that things are not, you can't find anything that makes it better, nothing that can make it worse. You've lost weight. I'm concerned about this. So we ended up getting a study done and unfortunately has cancer in his spine. It had spread to his lungs or maybe originated in the lungs, we don't know, and also has spread to his lymph nodes. It's something that I really wish I would have pushed harder at the beginning, because even just a few weeks could make a big difference in someone fighting cancer, and he's going to go through a pretty serious battle over the next couple, at least months, potentially years with this. And so I would say, if things are not making sense to you, trust your gut, especially if you can't make it better, can't make it worse. Something's definitely wrong. Keep asking questions. If you need to, recommend that the patient see another person for another opinion, but really trust your gut. That was a good reminder for me that people come into our clinics all the time with issues that are much more serious than an orthopedic problem. So good luck to you, and hopefully when you find these issues, you can get them addressed very quickly. I had another friend that I talked to who's a physician, and I asked him, does it bother you doctors when the PT says, hey, can I get an image study of this? Because I feel like something's wrong here. He said, well, at worst, we're going to find out that the person's healthy. So at best, you could save their life. At worst, we're going to find out they're healthy. That's never a problem. So just make sure that if you do feel something is off, you can suggest to the doctor that they're working with that you don't like what you're seeing, and hopefully they want to do some more imaging for it. Thank you.